Hello everyone, today we are going to talk about plastic surgeries. Skin changes in the face and body occurs as an individual ages such as wrinkle and skin discoloration as well as breast atrophy. Plastic surgery has become one of the most popular procedures in the world due to its role in rejuvenating and correcting the shape of men and women. Plastic surgery includes surgical and non-surgical procedures that enhance and reshape structures of the body to improve appearance and confidence. In this video, we will explain to you everything related to plastic surgery of the eye, nose, and breast, and you will be able to learn about the most popular cosmetic surgeries that are performed on these organs, how they are performed, and the expected results of these operations. Our role today is to answer most of your questions regarding plastic surgeries. Today we have Dr. Kim, who is a leading doctor at Ewha Seoul Hospital. He's going to discuss with us everything about plastic surgeries from an experienced medical point of view. I'm Uma. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Doctor, what is the difference between double eyelid surgery and blepharoplasty?
While they are slightly different, there are many similarities. When someone young does not have double eyelids and has surgery, it is often called double eyelid surgery. When older people undergo surgery to remove droopy skin, it is often called Blepharoplasty.
What is lateral canthoplasty?
Lateral canthoplasty is a surgery that lengthens and widens the look of the eyes. It can fix the issues such as the eyes slanting upwards or downwards and being too closed. Ultimately, it achieves wider and bigger looking eyes.
So is it a surgery that is done with Epicanthoplasty?
Depending on the needs of a patient, we do it. It is not necessarily to go together. Some requests, it is a standalone procedure. It does not have to go together with a double eyelid surgery.
Okay, so after the surgery, it happens that there are imbalances or scars. How do you do to solve this kind of problem?
Generally speaking, when surgery is done on both eyes, they tend to begin with slightly different shapes and sizes. Post-surgery, many may say the results are also imbalanced, but we try to do our best to be as symmetrical as possible. The double eyelid height needs to be as close as possible, so we try our best that the height is equal.
Do many people come after unsuccessful eyelid surgeries?
Even after surgery, there are many who are not satisfied, but that varies in intensity. In some cases, we can remedy it by doing minor touch-ups. In some other cases, that is not sufficient, so we must redo the surgery altogether. If the resulting look is not liked, if there is an imbalance, or it does not match the expectations prior to surgery, are examples of reasons why surgery is done again.
Then is it difficult to redo other doctors' work?
There are many who visit us due to dissatisfaction with other places. In such cases, it depends on the conditions, and we must listen to the patient's wishes and try to satisfy them. Many lost trust in their prior surgeon, so they tend to look for others. But there are relatively harder cases and very easy cases.
So, do you usually recommend non-incisional double eyelid surgery to which people?
Younger people are those who do not need to have dropping skin removed. We largely recommend non-incisional procedures because there's no need to remove the skin if not needed and create scars. So in cases where there is no need to remove skin, we tend to use the non-incisional techniques. If there is skin to be removed, or if in the past there is scarring left, which needs to be removed, or if the muscles that aid in the opening the eyes need to be altered, we use incisional procedures.
So moving on to nose or revision rhinoplasty. So what is exactly a revision rhinoplasty?
Revision rhinoplasty is basically for those who are not satisfied with their prior rhinoplasty.
So is there any big difference between normal rhinoplasty and revision rhinoplasty?
There are big differences. If someone already had surgery, there are lots of internal scars. The skin differs and the areas where the surgery was done has altered shapes inside. So the difference between initial rhinoplasty and revision rhinoplasty is big. Due to prior scarring, revision surgery has to consider the necessary maneuvering inside to achieve the results.
게 조금 더 어렵죠.
So, are there any new techniques used for rhinoplasty?
While new techniques keep coming to market, there aren't great leaps in material or tools used. Mostly it is still silicone, Gore-Tex, or one's own tissues that are used depending on the individual's needs. There are cases where, due to lack of availability of different materials, substitutions may be used but are not too common, as there are advantages and disadvantages.
So what is the difference between a filler and rhinoplasty?
Fillers do not alter the shape of the nose too much, but it can give some volume to the tips of the nose. Altering the shape, such as lengthening, shortening, etc., is difficult. But with rhinoplasty, pretty much everything can be altered according to the wish of the patient. We can make the nose higher, reshape the nose, and reposition the nose, etc. Fillers have limited capability.
So usually why people come back again for revision rhinoplasty?
Some may be dissatisfied with the resulting shape. Some may want a higher nose bridge or higher or lower nose tip or shape. Also, the implant may dislocate or shift location or harden and cause discomfort, or even infections. Those are the main reasons for revision rhinoplasty.
So, is there some cases where rhinoplasty is not good or is impossible to do?
Not being able to do revision rhinoplasty is rare. But if there are severe infections, the first step should be to remove all the implanted materials. Or if the skin or tissues are very damaged internally, revision may be impossible as is.
So, after the surgery, what should people do? How could they take care of their nose after the surgery?
Nothing in particular, but many will recommend skipping alcohol and cigarettes as they impede recovery from surgery. Patients should avoid touching and stimulating, making extreme facial expressions are not good for recovering.
So are there any side effects for rhinoplasty or revision rhinoplasty?
The reasons for revision are themselves the side effects. When the implant moves, resulting in a tilted nose due to internal tissues not being able to coexist in a stable location, or when the implant hardens and the nose separates internally.
So, please explain to us what is breast implant and breast lift.
Breast implant is for the patient with small breasts to make them larger. Breast lift is for those with drooping breasts who wish to be lifted back up. There are different surgeries. They can be done separately or together. Some may have sagging breasts that are also small in size. There are different surgical procedures.
So, are there many cases where both surgeries are done in the same time?
In reality, most do the surgery separately. For Koreans, there are those who have small breasts and want to make them bigger, and those who have larger breasts and sag who want them lifted. Doing both procedures together happens, but it is rare.
So for implantation, for breast implantation, do you have to replace it or redo it over time?
Replacement time frame is not set. While manufacturers claim they are for lifetime use and warranty is for a lifetime, new implants that are better appear, and over time they change over 10 to 20 years. Some rupture or get damaged and result in problems. They may be replaced with newer ones, but there is no set time for replacement.
So in some cases, the implants accidentally open. In that case, what should the patient do?
There are many such cases. In older times, when saline solution was used, there were many ruptures and even leakage and reduction. With silicone implants, there is leakage the patients feel. Older silicone implants. Leaks would result in pain and even infections. So if the patient feels pain or infection after enlargement, we examine it and can see whether indeed there was a rupture or not. In such cases, we remove them and replace them.
So is it possible to have breast lumps or mastopathy after breast surgeries?
Most when having breast surgery, we do not touch the actual breast but underneath the muscles, so there is no relation. So those are separate issues.
So what kind of person is not suitable to have a breast surgery?
If there are lumps, we must first find out what it is. And some have unauthorized fillers. Those are patients who are not suitable.
So after the surgery, what are the points that you should take care of?
Wear form-holding clothing and avoid using one's arms too much.
알겠습니다. Thank you so much, Dr. Kim.
Sure.
Today we learned many things about plastic surgeries, and the doctor explained in details everything related to these important surgeries. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and respond to you as soon as possible.